Imagine a world where your sexual health could predict your heart's future. Intrigued? Keep watching to discover the hidden link between erectile dysfunction and cardiovascular disease. Welcome to the Princeton Consensus Conference, a groundbreaking tradition dedicated to optimizing sexual function and preserving cardiovascular health. In November 2010, experts from around the globe gathered in Miami Beach, Florida, to update their recommendations on cardiovascular risk and sexual health. The conference had two primary objectives: evaluating cardiovascular risk in men with erectile dysfunction, ED, and no known cardiovascular disease, CVD, and reassessing cardiac risk associated with sexual activity in men with known CVD. Did you know that ED can be an early warning sign of cardiovascular issues? It shares risk factors with CVD and is an independent marker of increased cardiovascular risk. The panel emphasized the importance of exercise ability and stress testing to ensure a man's cardiovascular health is consistent with the physical demands of sexual activity. ED is not just a sexual health issue. It's a marker of significantly increased risk for coronary artery disease, stroke, and all-cause mortality. Incident ED has a similar or greater predictive value for cardiovascular events, as traditional risk factors like family history of myocardial infarction, smoking, and hyperlipidemia. In younger men, ED is far more predictive of coronary artery disease than in older men, making it a crucial factor in assessing cardiovascular risk. The panel recommends that all men with ED should have their cardiovascular risk assessed, including those with no known CVD. A comprehensive evaluation includes patient history, physical examination, and various tests like fasting plasma glucose levels and total testosterone levels. Testosterone levels should be measured in all men with a diagnosis of organic ED, especially if PDE5 inhibitor therapy has failed. Low testosterone levels have been linked to increased all-cause and cardiovascular mortality, making it a critical factor in ED and CVD management. Lifestyle changes can significantly reduce cardiovascular risk and improve erectile function. This includes smoking cessation, regular exercise, and a healthy diet. The Mediterranean diet, rich in fruits, vegetables, whole grains, and lean proteins, is highly recommended for cardiovascular health. In high-risk patients, sexual activity should be deferred until the cardiac condition is stabilized. These patients should be referred to a cardiologist for further evaluation. Non-invasive cardiovascular evaluations, such as exercise stress testing and coronary computed tomographic angiography, can help identify asymptomatic or undiagnosed coronary artery disease. The panel also recommends measuring biomarkers like high-sensitivity C-reactive protein and glycated hemoglobin levels to detect subclinical CVD. ED treatment should always be secondary to maintaining cardiovascular function. PDE5 inhibitors like sildenafil are widely used but should be prescribed with caution. For men with low or intermediate testosterone levels, testosterone replacement therapy, TRT, can be considered, especially if PDE5 inhibitors have failed. The panel encourages a collaborative approach to managing men's sexual function and cardiovascular risk, incorporating expertise from various medical fields. Sexual function should be part of the initial cardiovascular evaluation for all men, regardless of the presence or absence of known CVD. Exercise ability can guide physicians in estimating cardiovascular risk associated with sexual activity. High levels of habitual physical activity can attenuate the risk of acute cardiac events. Low-risk patients can generally perform exercise of modest intensity without symptoms and can initiate or resume sexual activity and ED treatment without further testing. High-risk patients, such as those with unstable angina or uncontrolled hypertension, should defer sexual activity until their cardiac condition is stabilized. Indeterminate risk patients require further evaluation using exercise stress testing before resuming sexual activity. The panel's recommendations emphasize an integrated approach to risk assessment, considering multiple aspects of cardiometabolic health. A comprehensive approach to cardiovascular risk reduction will improve overall vascular health, including sexual function. The panel's recommendations build on those from previous conferences, ensuring that each man's cardiovascular health is consistent with the physical demands of sexual activity. The Princeton Consensus Conference continues to be a beacon of hope, guiding men towards better sexual and cardiovascular health. Stay informed, stay healthy, and remember, Your sexual health could be the key to unlocking a healthier heart. Thank you for watching. For more insights on health and wellness, subscribe to our channel. Your heart and health matter.